Hey guys, Dr. Sil here, and tonight we are doing a reaction video to a video from 1976 about a man who is suffering from obsessive compulsive disorder. Now, like last time when I did a video reacting to catatonic schizophrenia, I'll also be translating in this one. So without further ado, let's get into the video. Now, this video is from the channel Pika Grape Snacks, and they have a really good collection of footage from the 50s, 60s, 70s, 80s that relates to old medical videos and mental health videos. And I think it's really interesting to see the old videos from what psychiatry used to be, because, you know, if you don't think about your past, you're destined to repeat it. And psychiatry definitely has a dark past, and there's so much to learn from it. But anyway, none of that in this video. This is just a discussion with someone who has. And so here we have the video about a névrose obsessionnelle invalidante chez un sujet jeune. That's just obsessional neurosis that's debilitating. That's what they used to call it in a young guy. So let's begin. I don't like this image. It's very creepy. It gives a sense of paranoia that someone's just monitoring, you know, you through the window. I'm actually going to stop there. So just so you know, the first thing that mental health professionals do is a mental state examination. And it's something they do ongoing throughout the review. It's actually really hard for medical students to do this because you have to have your conversation, but also internally do what's called a mental state examination. And it can start straight away. So when I walk into the room, I've already seen things that tell me a lot of information. First of all, the appearance. So he's well groomed. I can see that he's well dressed. He's sitting calmly in the chair. And just from the first sounds of his voice, bien, he's not manic. Let's continue.
Les premières difficultés que j'ai rencontrées, c'est en fait lorsque j'ai quitté mes parents pour rentrer à l'école normale supérieure. Je me suis retrouvé donc en résidence universitaire à Paris.
So the first problems I encountered was when I left home from my parents to start at university and move into the university.
De signature.
And he was having problems with signatures.
Notamment les papiers administratifs, enfin, ou signer un chèque devant un commerçant.
Trouble signing like checks in front of, like for the university or for administrators. And he was quite anxious. He thought he had a duodenal ulcer. And a cramping of the left arm.
Bien avant d'avoir à la faire, enfin. Je pensais bien avant de rentrer dans une.
So what he's just said is that he started having problems with signatures after he left home to go to university, and it was also associated with duodenal ulcer, the sensation of a duodenal ulcer, and cramping of the left arm. I just wanted to pause here to describe the fact that anxiety is often associated with somatic symptoms, with physical feelings. It is, you know, you feel muscle tension. It is a physical thing. And it's an important thing to remember that the brain and the body are one. They are connected. So if you have problems in the mind, you can also have problems in the body. The other thing worth noting is that OCD is, you know, an anxious disease. So the kind of theory of OCD is that first you have anxiety about a certain thing. So for him, it was writing his name, and then that results. That's your obsession because of the anxiety. You obsess over it. So he might have had obsessions around not writing his name correctly, and that could have been very debilitating. You also have to quantify how much of the day does this obsession take up. But then that leads to the compulsion, okay? That's the O is the obsession, the C is the compulsion. Compulsion is a behavior. You can have mental compulsions, let's not get into that, but most of the time it's a behavior. And so for him, it might be re-signing and, you know, having to re-sign things over and over and over and over again until it appeases his obsessions and relieves the anxiety. The problem is, it's only transient, and the anxiety comes back, and then the behavior comes back, and it can take up hours of your life. It can be extremely debilitating, OCD. It is a spectrum of severity, and it can really impact your function. It can affect people's jobs, relationships, everything. Let's keep going.
Une banque que j'aurais assignée 2 heures après, par exemple. Je me suis marié en 74, donc avec ma femme.
So he's married in 74.
En ayant d'ailleurs des réticences, c'est-à-dire que j'ai vécu 2 ans avec elle avant de me marier.
They lived together for 2 years and then were married.
Elle tenait à se marier pour avoir un enfant. Et
she wanted to marry to have kids.
Moi, disons que j'aurais préféré attendre.
He wanted to wait. He didn't want to get married.
vivre maritalement sans être
He wanted to live together but not get married.
au retour de notre voyage de noces, disons, on a
So guys, I just wanted to pause there to describe his affect. So another thing you can do, you can describe the appearance quite instantly, but you can also describe people's affect. Now what is affect? In the mental state examination, you have to assess their mood, how they feel, and their affect, which is kind of like how they look in the present time. Affects can be described as euphoric, and reactive, where they use their facial expressions, or they can be kind of flat, which is no facial expression at all, or blunted, which is reduced facial expressions. For him, I would describe him as quite intense and with a slightly reduced affect, and he kind of looks a bit anxious, he's very serious and stern looking.
Ensuite vient... C'est quand ma femme a été enceinte que j'ai commencé à ressentir des angoisses.
So his wife became pregnant, and that's when he started becoming anxious again.
Notamment dans le domaine de la lecture.
And he found that he has issues reading.
J'éprouvais un certain désintérêt pour le...
Oh, he was disinterested in reading. So this sounds like...
livres, alors qu'auparavant j'ai beaucoup lu.
And normally he would read a lot. So whenever someone says that they used to have an interest that they did a lot and then they stopped doing it, this lack of kind of interest is often referred to as anhedonia and can be a symptom of a major depressive episode.
Je devais avoir des préoccupations.
Oui. The interviewer is just asking, you must have had important things to do other than reading.
Que je me sentais un peu rejeté du fait que ma femme était enceinte.
Okay, he's describing that he felt a bit off, that his wife was pregnant. Oh, because his wife was becoming a mother rather than a wife. Oh, instead of a lover.
Et puis ensuite vient
Okay, I'm going to pause here for something really interesting. Something you have to be very aware of as a mental health professional is countertransference. And it's, essentially you analyzing how someone makes you feel. And when you observe that analysis, you have to observe it so that it doesn't affect your care for that person. So someone with antisocial personality disorder who's, not respecting the rights of others, is violent, maybe beat up some weak people, whatever, that can make you feel very frustrated. Now with him, I'm actually getting a bit of counter-transference. That frustrates me that he is worried about how he feels when he's got a pregnant wife who's becoming a mother, and all the things she must be going through. And I'm thinking that there's my counter-transference, my instinctive response is that he's too absorbed in how he's going. But of course, that's not the whole picture. He's feeling this way for a reason. We have to understand that reason so that we can help him, and thereby that would also help his wife better. So anyway, that's just a point about countertransference. So transference is how a patient feels to the therapist, and countertransference is how the therapist feels to the patient.
Ces difficultés, c'est les lenteurs qui s'en suivent dans la manière de vivre. Donc elle parle même de séparation avec moi, et d'autre part, je suis en congé de longue durée depuis un peu moins de 2 ans maintenant.
So he was just saying his symptoms are coming back and that his wife, it's causing problems in his relationship. His wife is thinking of separation and divorce. So that is definitely fulfilling criteria of functional impact. This is a good learning point. Whenever you diagnose a mental illness, for it to fulfill the DSM criteria, the DSM being that big statistical manual that mental health professionals use to diagnose mental illness, one of the criteria is this mental illness has to cause functional impairment. So if you have obsessions, which, we all have intrusive thoughts, like, a jingle, if you're watching an ad and the jingle gets stuck in your head, that's intrusive. It's semi-obsessive because you can't get it out of your head. But that's not causing you functional impacts. You can still maintain a healthy relationship with your loved ones, or you can still go to work or study or whatever. But when it's causing problems, like it is for him and his wife, and I'm sure it would be causing problems with his work if he's not marking papers efficiently, then it really fulfills the criteria of a mental illness. So he needs to be managed well. Now, so the management of OCD is pretty complex. We'll talk about that in another video. I'll make it this weekend actually. I think it's really interesting stuff, but it involves some things like exposure therapy, anxiety management, psychotherapies, not necessarily like, and I guess an interesting part of the management of OCD is sometimes you can spend a lot of money and time trying to figure out why you have an obsession, like say washing your hands, or keeping doors closed or whatever. But actually it's really about the functional impact. So if you or someone you know has OCD, they don't necessarily have to go into their unconscious mind and try and understand the origin. Really, you just want a pragmatic, practical answer on how to continue functioning normally. And that can be achieved with, cognitive behavioral therapy, some SSRIs. So in depression, you use fluoxetine quite often, but with OCD, you use fluvoxamine. That's a common SSRI used in OCD. There are others as well. And just good social support as well while people go through that management phase. So that's it for this video. That was very interesting. We could see how writing signatures and rereading were the obsessions, and rewriting the signatures and rereading the different lines with the kind of compulsions for him. I think he would definitely benefit from significant management. I think he needs help because it looks like it's impacting his relationship with his wife. I don't know if he needs an admission in a hospital. This seems like it can be managed as an outpatient because there's no kind of acute risks. Although we didn't actually do a proper risk assessment, which you always have to do when you're considering whether someone needs a hospital admission or not. So yeah, if you enjoyed that, please leave the video a like. You can subscribe to the channel, that helps me grow. And I wish you all an absolutely wonderful day, and I'll see you all in the next video. Bye for now.